Hi, I'm Amanda Missey. I am the President and CEO of Bergen Volunteer Medical Initiative. We provide free primary health care to people who don't have insurance and who earn under a certain amount. So for an individual, if you earn up to $36,000 a year, you could qualify for our services, and if you have a family of four, it would go up to about $72,000 a year. Even though we don't see children, because children are covered under New Jersey Family Care, by keeping parents healthy, or grandparents, or big sister or big brother, we really keep the entire family healthy. As far as employers are concerned, we know that there aren't a lot of big businesses. Most businesses are small and medium-sized businesses who often can't afford to provide health insurance for their employees. So we can fill in the gap there, again, as long as people meet our income qualifications and they don't have insurance. So we could be a good option for employers to keep their employees healthy. Well, one of the things that we are able to do is keep people out of the emergency room. Going to the emergency room for non-emergent issues like an earache or a headache or, I don't know, a cold is not a very economical way to keep people healthy. It's very expensive, in fact. So we keep people out of the emergency room and save everybody money that way. We also keep, it's kind of about population health. We keep people healthy. If there's a flu epidemic, hopefully they're going to, our patients will come in here and get treated for whatever they've got, and we can keep, more people healthy that way. I'd say by the end of 2018, I'd like to see a 20% increase in the number of patients that we serve. Right now, we see about 1,000 patients a year in 6,200 patient visits, so they come here a lot. And I'd like to get up to about 1,200 patients by the end of 2018. That we need to have an accompanying increase in the number of volunteers that we have, because the care here is primarily provided by volunteers. So we are actively looking for doctors and nurses and nurse practitioners, and then also more people to support the cause, because if we're going to have more patients, then we also need to have more supporters of the organization. Okay. When I took this job 3 years ago, somebody actually said, "Amanda, why are you taking that job? The ACA is going to, put you out of business pretty quickly." It hasn't. We've actually had a very steady patient population for the last 3 years. And depending on what happens with healthcare reform this time, I think whatever happens, we are going to have more patients. There are definitely a lot of people who are going to lose their health coverage. Probably the biggest effect for us is going to be if they change Medicaid to a block grant system. It's going to compress the number of dollars in the system for people, and we are going to have a lot of people who are now on Medicaid moving off, and they will come back as our patients. There are probably at least 40 or 45,000 people who qualify, yes, and that could change depending on what happens with healthcare reform. So for employers, we actually have payroll stuffers that are available in English, Spanish, and Korean that list the criteria for people to become a patient. So employers can call us at 201-342-2478 to get those payroll stuffers. For individuals and families, so the income criteria is that an individual can earn up to $15,000 a year. A family can earn up to $72,000 a year. There has to be earned income in the household, so somebody in the household has to be working, but it does not have to be the patient. They have to live in Bergen County, and they can't have insurance. So that means there's no private pay insurance, no ACA or Obamacare, no Medicaid or Medicare. So if patients think they qualify, they can call us at 201-342-2478. Whoever answers the phone will do a quick phone screening to determine whether the patient is a candidate, and then make an appointment for that person to come in for an eligibility interview. I want to tell donors that are potential donors that BVMI is a wonderful place to make an investment. It's an investment in the health of the community. It's an investment in a place that really values people, a place that gives people dignity and allows them to stay healthy so they can keep working, which is really important for them to be able to take care of their families.